My name is Anne Wilson, and I'm delighted to welcome you all to Emerge Australia's Symposium on World Severe ME Day 2025. I wish to acknowledge the traditional owners of the lands on which we meet and pay my respects to elders past, present, those emerging and listening to this symposium today. Severe ME is a topic very dear to our hearts, given 25% of people with ME are either housebound or bedbound. Through this symposium, Emerge Australia wishes to be the light for all those impacted by severe ME. A warning, what I'm about to say and what you will hear today may be challenging to some of you, and for that we apologise. However, if we are to be your light, your stories and experiences need to be told and are critical to our advocacy efforts on your behalf. I want to quickly draw on the words of the World ME Alliance on this important day. Severe World ME Day. A day in darkness for those with severe and very severe ME. A day where you wake up but don't shut your eyes. A day when the light is too painful, where even a whisper is too painful because it is too loud. A day where food is placed beside your bed and you can't eat today because your body hurts and you can't move. Even thoughts hurt. You're alone, in silence, in stillness. This isn't just one day. This is every day, for weeks, months, years. Very severe ME leaves people in darkness. Today, be the light. With a little help from our friends on this symposium, namely Lily Schubert, Lynn Harris, Sue McPhail and Laura Allen, Emerge Australia is focusing on the importance of multidisciplinary in-home support for people with severe ME. This session will be recorded and made available in the coming days in audio and video formats to further support engagement. Whilst every effort will be made to stick to time, in the event we go a little over, we understand some of you may have to leave, and that isn't a problem. Feel free to comment on social media and follow Simone Ison's live Blue Sky feed of proceedings. Given recent announcements, it would be remiss of me not to mention the Decode ME study that discovered 8 areas of genetic coding in people with MECFS out of a study cohort of 250,000. People with ME the world over are today feeling validated and vindicated as a result of that study. Tune in to the ABC Nightlife program tonight, where Dr. Richard Schluffel and myself will be speaking about the outcomes of this study. So apart from advocacy for in-home multidisciplinary supports so critical to those with severe ME, Emerge Australia today is shouting from the rooftops that our federal government needs to invest in Australian MECFS research. It's time. There is a genetic link. Let's support the best research minds in Australia to identify a biomarker. Let's advocate for drug developers and appropriate funding for MECFS to speed up the discovery of treatments. The time to act is now. People with MECFS must not be left out any longer, and we need to end the darkness now. So today I'm delighted to welcome our first panellist, Lily Schubert. Lily is a Sydney-based content creator and chronic illness advocate known for her candid storytelling on TikTok, among other areas. She's here to share her ME journey. She spent 6 years largely bedbound. To tell her own story, please welcome Lily, and please watch this brief media piece courtesy of Channel 7 recorded earlier this year. And after that, I'll come back and we'll hear from Lily. Thanks, Andrew.
Well, now to an extraordinary tale of strength, resilience and hope. At just 16, Lily Schubert was struck with a life-altering, devastating diagnosis of a severe chronic illness. By 17, she found herself completely bedbound, staying that way for 6 long years. 6 years, unable to even roll over or lift her arm without excruciating chronic pain.
But just 1 year ago yesterday, Lily defied the odds to finally step outside again, and the world took notice. The powerful moment went viral, amassing over 7.5 million views. Now, with 65,000 followers, she has become a beacon of hope for those living with invisible chronic illnesses. To tell us more, Lily Schubert joins us live here on the studio, here on the couch. It's so lovely to see. What a journey you've been on, right? Can you share what chronic illness that you've been battling and how that actually took over your life, Lily?
Yeah. So I've been ill for coming up to 9 years now with an illness called ME, myalgic encephalomyelitis. It's a chronic neuroimmunological illness. And for 6 of those years, I was completely bedbound and profoundly disabled. It's an illness without a cure and with no standard treatment. So at 16, I was essentially handed a life sentence with a prognosis that allowed for no real hope of improvement or recovery.
Lily, we heard in the intro, 6 years, bedbound for 6 years. That's, for most of us, that's impossible to start to comprehend. How would you describe those years in your life?
My reality through those 6 years was that I existed in my bed, in a completely dark room with almost no human contact. I could barely speak, I couldn't think clearly, and I couldn't move. Physically, I was in excruciating pain and fatigue every moment of the day. You know, I used to say that I would wake up and count down the seconds until I could sleep again because being unconscious was the only relief.
Yeah, we can see from those images just how you appear very, very ill. I'm really sorry that you've gone through all that. But then, exactly a year ago, you shared this video of you leaving your apartment for the first time in a long, long, long time. It went viral. Tell us about the year-long lead-up to that moment. Like, how did you get out of bed?
Good question. So basically, over the 8 years that I was sick leading up to this moment, I tried a lot of different treatment and medication. We were pretty relentless in our pursuit of anything that would offer me even the tiniest glimpse of improvement, and nothing worked. And then one day something did, and it wasn't an overnight miracle. It was more like a slow journey back to having energy in my body, and I started to feel human again. I could speak, I could have light in my eyes, and slowly I could start to move. It was a really precarious journey because there was no guarantee that that improvement would stay, that it was safe for me to move in my body. So it was a lot of tentative, incremental steps until one day, a year later, I could finally open my front door and walk outside of it.
Lily, amazing story. Not just the physical side of things. It must have been a huge emotional element for you and your family.
Yeah.
Right? How did you deal with the emotional, psychological side of what we're talking about here?
What I went through was incredibly traumatic. It was also desperately, brutally lonely. I was deprived of human connection, of connection to the world. I couldn't even look outside my own window. I couldn't speak. I couldn't be with the people I loved. And it required, honestly, an inconceivable level of emotional endurance. I don't really know how I found it. My dad's actually here. He drove me here today, and on the way here we were listening to the song Fix You by Coldplay, and it really reminds me of him. He's a big reason that I got through this. You know, he used to say to me, Lil, you can't walk, so I'll carry you. And he did.
That's beautiful. That's beautiful. You've been documenting all these first outings and you getting to re-experience little bits of life's moments. How are you tracking today?
It's been a big year, overwhelming in a lot of ways. I started to share on TikTok because my cognitive capacity improved first and I wanted to re-engage with the world. I wanted to feel less alone in my journey and hopefully make some other people feel less alone too. And in this past year, I've gotten to breathe fresh air, feel my feet on the ground, feel the sun on my skin, all for the first time. It's been incredibly surreal. But what I've also realized is that there's duality in everything. I'm so relieved and I feel so much joy because I truly had reached a place of acceptance that I might never leave my bedroom again. And also, it's incredibly challenging to re-enter a world in such a fragile state, to try to rebuild a life in the wake of what I went through, and in not knowing how long this will last, if it'll be forever, or if I could go back to where I was.
So many people watching would find it impossible to understand what you've been through, but what do you need people to know about chronic illness?
In my experience, so many people have great intentions, but what I think sometimes we lack as a society is our ability to sit with a problem that can't be fixed. So much of the narrative around health conditions and how to support someone in them is all about cures and treatment, and we don't do as well when things are opaque and open-ended. It leaves people with ME and many other chronic health conditions alone, often neglected and ignored and invisible to the world. So I would say that if there's someone in your life going through something like this, reach out and try to understand, try to offer care that isn't predicated on fixing, but instead just standing beside someone in their pain and not leaving them to suffer alone.
Just being.
Yeah.
Just being with them. Lily, you are an amazing young woman. You're 24 years of age now. To hear you speak, you're a real inspiration, so well spoken.
Thank you.
Very powerful. Lovely to see you this morning.
Thank you.
And lovely to see Dad there too.
Dad's over there holding your handbag.
And the camera. We're back right after this.
Wow, Lily.
Wow.
Welcome, Lily Schubert, to this symposium. It's hard to know where to start from because Larry and Kylie asked so many wonderful questions. I guess I've just got one question and we'll just bounce off from there. Did you ever think you'd get to the stage you are at today when you were so ill?
No. No, definitely not. I lived through most of my ill years and most of my ill days truly feeling like there was no light at the end of the tunnel. No sense of hope, no sense of anything outside of the four walls that I existed in and the pain in my body. It was impossible to look or feel beyond that. And because of the state of understanding and research of ME in the world currently, it meant that I don't feel like there was really a lot of hope given to me either. I really actually respect, my doctors and everyone for offering me so much care without giving me a false sense of my future, because I think it would have been incredibly hard if I kept continuing on hoping for something that I wasn't going to get. And the fact that I landed here more well than I ever believed I would reach is a miracle to me.
Oh, it's a miracle to us and such an inspiration, because there will be people, who will be listening to this, who either have severe ME or their carers will be listening.
Mm.
And, they'll say, we can't even think of a day
Mm.
when we can get out of bed.
Mm.
And, from my perspective, listening to the fact that you tried so many things, was there one thing that was the beginning for you, as in the first glimmer of something that
Mm.
your life might very, very gradually transition out of being very severe?
Yeah. Yeah. So, like I said in that interview, I was in quite a privileged position to establish the relationship I have with my doctor before I became bedbound. And I know not everyone is that fortunate. She is a really wonderful doctor and cared for me before I was bedbound and throughout my years that I was bedbound and continues to care for me today. She offered telehealth, she visited me at home, and I don't think I would be where I am without that support and care from her. We tried a million things. So sure that everyone who's watching has probably had a similar experience. You go through so many phases of hope and then let down when each thing fails or often makes you feel worse. For me, about 3 years ago, 2.5 years ago, can't remember exactly, I started on a couple of medications, low dose Abilify and low dose naltrexone. And it was the first time in 8 years that I'd ever felt the tiniest bit better. And I thought, I don't want to believe it. I really don't want to believe it. It's too scary to have hope. But it just kept proving me wrong. And my body just kept feeling a little bit better. My mind was clearer. And things came back into my life that I never thought I would regain. I got to see my family, talk to friends, get a bit of light in my eyes. Those things just shifted my world entirely.
That's just unbelievable.
Mm.
What does life look like for you today?
Life is, it is a whole big mix of things. It's really not simple to recover from the kind of trauma that severe ME puts you through. And so I never want to give a sense that I'm just living large and, blissful, but I have so much gratitude and appreciation and relief for every little bit of life that I get to live. I have so much appreciation for the ocean and the sun and my feet on the ground. To feel movement in my body is pretty miraculous when I had to stay still for so long, when I was in darkness, when I couldn't speak and think. I, yeah, I get to go out with my friends, I get to work a little bit. All of that is all really new, and I'm still figuring out how to establish a life. And like I said in that interview, it's really complicated because I'm definitely not cured. I still have symptoms every single day. And so it's all about managing new things and being cautious and just taking it one step at a time, one day at a time.
From a management perspective, because that's really interesting,
Mm.
what are the things that you do that help you manage the energy levels that you've got? Because I suspect they'd be fluctuating still.
Yes.
What are the tips as far as management of your energy that you are using today that you find most helpful?
Mm. I would say one of the greatest things that I've ever done for myself was establish a relationship and a connection to my body so that I can read it well. I suffered a lot from dissociation while I was bedbound because being in my body was so incredibly painful. So naturally, I tried to escape it. Um, and so I worked with a therapist and a physiotherapist who is incredibly intuitive, and my therapist is somatically trained. And both of those people really helped me connect back into my body. And in doing that, now I'm so much better at being able to assess my energy levels. I don't think anything would have helped when I was bedbound. There was no energy to assess, there was no capacity to live in. Everything hurt and everything caused a crash. But now that I have an increased capacity, the best thing that I can do for myself is just check in consistently. And sometimes that gets tiring. Sometimes I want to tune out and live normally, live like my more able bodied friends. But I try not to take the energy that I have now for granted, and I continue to rest all the time. I continue to take breaks all the time, continue to treat my body as well as I possibly can. Yeah.
I guess there would always be the tendency to want to overdo it because you're feeling good, so you want to do everything.
Yeah.
And obviously with ME, let alone severe ME, you
Mm.
know that you're going to crash. So having to really be disciplined
Yeah.
in the use of your energy and how you spend that energy is going to be really, really important.
Mm.
What what words of encouragement can you give to people who are listening to this who have severe ME, who are bedbound in particular? And are there any tips for the carers that you might have from your experiences?
Mm. Gosh, that's a big question.
I know, sorry.
That's okay. um, Gosh, what I'd like to say to severe ME, when you ask me that question, my answer is to think back on that version of myself and what I wish that I could give her based on what I now know. I have immense respect for that version of myself because what she survived was unimaginable. And so I never want to sort of be so glib as to say, hold out hope or keep hanging on, because I think no one can understand how hard it is to
No.
do either of those things until you're in that situation. What was more important to me than holding on to hope was just holding on to myself, and continuing to believe that I was worth fighting for, and that my life was worth fighting for, even if it was so diminished. Um, and to carers, I have been incredibly lucky. My carers were my parents, and they're extraordinary. They really are. And they took care of me moment to moment, day to day, even when I couldn't communicate with them. And it's just such a brutal position to be in as a parent or a caregiver. And I think truly I've only understood the gravity of that now that I have more capacity and get to witness my parents in the sort of grief that they carry and the trauma they carry.
Mm.
Um, I would just say that finding external support as a caregiver is so important. Having people that you can rely on because you are in such a position of taking care of someone often 24/7 if your child or whoever has severe ME. So yeah, having that external support I think is so important. And trying to, my dad always tried to hold hope where I couldn't. And so if you have the capacity to do that, to maintain in the know, continue to research, continue to advocate, you're doing an incredibly powerful thing for your loved one.
Lily Schubert, thank you so much. I'm sorry that the questions weren't necessarily easy for you, and I get a lump in my throat when I ask them, so I can't imagine how difficult it may have been for you. Thank you, and we'll come back to you when we have the questions after we've heard from our other panelists. But thank you so much, Lily.
Thank you.
So our next panelist needs little introduction. She has so poignantly shared her family's journey with severe MECFS in 2 previous episodes of the Emerge Australia Imagine podcast series. Lynn Harris is a former junior primary school teacher from South Australia who became a full-time carer for her eldest son, Dan, after he developed severe ME in his early 30s. For over 3 years, she's provided 24/7 care, supporting him through extreme physical limitations and inability to feed, hydrate, or communicate. Lynn brings a very, very powerful voice to the conversation advocating for those who are often unseen, unheard, and in the dark. And welcome Lynn Harris to this symposium.
Hi, I'm a bit, gosh, Lily, gosh, that's all I can say. Very powerful, very powerful. And I do wonder if Dan could speak, that he would look back on his time if he emerges, and his time being bedbound and being very severe. I really don't know what to say. I think you've summed everything up perfectly, if that's the right word to use.
Lynn, I guess one of the things I wanted to ask you about today, because we are advocating for multidisciplinary in-home care for those with severe ME, you have some unique challenges with Dan with regard to him accepting help in the home, especially from his GP.
Yes.
Can you tell us a little bit about what might make your life a bit easier as a carer, and also the unique perspective that you have of not being able to get a GP to see Dan at home?
The GP that Dan has is more than willing to do in-home visits. It's actually Dan who refuses them because his health is so precarious and such a limited capacity that he feels that the GP would offer no benefit, and there's a very strong chance that could cause deterioration for no benefit. So, and where we live, I think, Anne, you said we've hit the jackpot because we are regional, almost remote. So for Dan to lose the ability to chew would require a nasal gastric tube at the very least. And for that to happen, he would have to go to Adelaide, which is 700 kilometres away, and that would be an air ambulance flight. And he's not willing to take that risk. So his health is precarious. So at the moment, he seems to be plateaued out, almost stable. When I say stable, I should imagine that every day he is suffering in the dark, in silence, with earplugs in and an eye mask, and limited interaction with myself and my husband, who are his carers. He's just not prepared to risk it, to have the GP to come in, because he feels the GP has nothing to offer. And I have to agree with that, and I have to honour that. I could intervene and say, yes, well, it's time you had a blood test, we need to check some levels, but he needs to be able to trust us that his wishes are honoured. And so we do. But I do, in saying that, I do have every 12 weeks a telehealth appointment with Daniel's rheumatologist, who is an MECFS researcher. So he's very interested in Dan's progress or lack of it. So he checks in and he sends his notes onto the GP. So everyone's in the loop. It's just that no one gets to actually see Daniel. And if anything changed either way, then we'd have to rethink our position. And it's been like this. We marked the anniversary. Well, I don't know whether that's the right word for it. It's been 5 years since Dan's been since we've brought him home, and he's been in his childhood bedroom and not left it for 5 years. So it's traumatic. Lily, it was interesting that you were saying that your parents, you can look at them and see the trauma that it's caused. And it's true. It's to witness someone you love going through that much misery relentlessly is traumatic. So, yeah, it's horrid, just horrid. And it just feels like we're marking time until something happens one way or the other. And we have tried many, many different medications, and the ones that you've tried, Lily, which worked so miraculously for you, did not work for Dan. And we trialed them, in ever decreasing doses for quite some time, and just made everything worse. So we're just waiting for what? I'm not quite sure, but we're waiting.
So, Lynn, it's such a it's so gut-wrenching to hear the pain, you're a mother, you're a wife, the trauma that you go through is just, it's unspeakable. Who supports you? How do you get support as a carer in this situation?
Well, I do meet Zoom meeting with a whole bunch of other people who are in virtually the same position as I am, and that's through Emerge, setting up those carer groups, which are invaluable to talk to other people who are in the same position, who absolutely understand when I say things like, I was able to change Dan's sheet today, and they're all really impressed. It might not seem much, but to someone who is bedbound and with limited movement and the inability to tolerate someone else in the room for any length of time, to be able to change the bottom sheet is huge. One, for me, because I know it needs changing, and two, because I know it must feel better on his skin. So, but these people understand it, and just any little glimmers of joy that you grab onto and are able to share are great. And at the other end of the spectrum, any sadness or horrible things that happen, you can offload as well, it's brilliant, absolutely brilliant. And I have a lovely husband who helps a lot. It's great.
Yeah, it's a team, isn't it?
Yeah. Oh, absolutely. It's Team Dan for sure. And I just have to share, our youngest son is currently traveling in Taiwan with his girlfriend, with his partner, and they sent me a little video yesterday of the wishing lantern, and somebody filmed it for them, and you have to write the wish on the lantern, and it said wishing for Dan to get better. And it made me cry because I realised not only are we traumatised, but his brother as well, who hasn't seen him in 5 years because he just can't tolerate anyone else in the room. So the impact of this illness isn't just on the person suffering, it has a ripple effect on the entire family.
Yeah, absolutely.
And the way that they live their life as well. It's a horrendous illness. It's just horrendous.
Lynn, if you were speaking to our health minister right now, what would you want to tell him?
to funnel money into research, and not just any research around MECFS, but research that's going to be really helpful, and to look at the current research, not clinging on to old beliefs or old suppositions, but to be looking at the current research and really do something for people like Dan, at the severe end of the spectrum, because the impact on our family is huge, and it must be impacting. If we are one of 250,000 people, that's a lot of people that are impacted in society, and it must have economic implications. So let's educate all allied health people. The thought, Dan, Dan is horrified at the thought of having to go to hospital, not because he may become more unwell there, but it's all the people that he would be dealing with in that environment. It just terrifies him. Never-ending torture, I think he wrote. Please, no hospital, never-ending torture. So it's the education that we need for everybody involved in the health system, and accommodations that need to be made for these people to have healthcare, not just you'll be right. No. And the impact that post-exertional malaise has on these people, and their capacity or lack of capacity, really needs to be raised. So the Federal Health Minister, just help. We need more money, we need more research, and we need education to all allied health people everywhere.
That's wonderful. It actually does tie in with our priorities to educate clinicians first and foremost, and allied health professionals, but we do need money for research in Australia for MECFS, which government have been silent about since 2019. So we'll certainly be taking those issues forward to the Health Minister. Lynn, you're a remarkable woman, and every time I speak to you, it's it's always just such a joy to speak to you and have just the most candid discussion about what you're going through, about what Dan's going through, and I always leave feeling we've got to do better. We've just got to do better, and it's incumbent on all of us to do that. And so I just want to thank you for having the courage again to come and tell your story today on Severe ME Day. And whatever Emerge Australia can do, if we can give you more multidisciplinary care in the home, whether we can give you more support through our support groups or counselling on our helpline, you know that we're always here for you and others who are listening today. So thank you so much for your time today.
Thank you.
I'll talk to you when we come back to question time, which I'm being told I need to check. So thank you. My next panelist is going to come to you via video and interviewed by Emerge Australia's own Laura Allen, Head of Patient Services. Sue McPhail will speak with Laura on accessing the healthcare system and lots more. Sue is a mother, early childhood educator and full-time carer for her child with severe ME. We welcome Sue and Laura via video, so we can run that now. Thank you.
Thank you, Sue, for agreeing to do this. I know that it's a lot to take on when you have such big caring responsibilities. Today, what we really wanted to focus and highlight is the incredible need to have GPs been available to see people in their homes and meet them where they are at this point in time. Can you firstly share a little bit about severe ME and what that has been for your experience with both yourself and Beck as a person with lived experience?
Yes, thanks, Laura, for inviting me on today. With severe MECFS, this usually means they are bedbound or mostly bedbound. And bedbound means just that. They are either unable to get out of bed at all or only for very brief periods, maybe to go to the bathroom. And having to leave home to go and see a GP would be almost impossible for most. At the very least, they may need ambulance patient transport because many cannot tolerate sitting up, even for short periods of time. This is known as orthostatic intolerance. The movement of the vehicle can also be extremely disruptive to their nervous system. They can have intolerance to light, and usually at home, they are in a darkened room, often with an eye mask. Sound is often the big one. Intolerant to most sounds, even conversations can be difficult. It's like an overload to the brain. All this stimulation would most likely cause what we call a crash, where the overload on their body's nervous system just shuts down and causes an increase to the symptoms. This can often last hours or days afterwards, even possibly not returning to their pre-existing baseline. In other words, it could cause harm.
And just to frame it a little bit for your personal experience, how many hours would Beck spend sitting upright in bed or out of the bed a day?
Becca doesn't get out of bed at all. We do have a hospital bed, which allows it to be increased to about 30 degrees for when she's feeding, but it's now been more than 12 months since Rebecca's actually been out of bed at all. In other words, her feet have never touched the ground.
So if we think about the last 5 years, how many times has a GP been into your house and visited Beck at home?
Twice. So we had one in 2020 that came out during COVID and helped us to access NDIS. We needed letters and things from the GP. They also organised to have some blood tests done. And then Rebecca was discharged from hospital a few months ago, and we had a new GP take on Rebecca's case, and he's been out to see her after she came home from hospital and is available for ongoing home visits.
A question, if it wasn't for you, would Beck be able to do this on her own?
No, Beck has trouble having conversations. Some days it's pantomime or sign language. Some days she said she's got lots of questions she needs to ask, but I might get one of those questions. Yeah.
So pretty impossible for someone who has the level of ME that Beck has to reach out and find their own healthcare and advocate for themselves.
Yes. So even when the doctor does come out, I have to answer most of the questions, and then they just pop in to see her, say hello, and ask a few questions they may need to ask her. Even we found challenging in the hospital, sometimes they would ask when giving medication for her name, her date of birth each time, and she found that exhausting, that each time she had to give her name, her date of birth, put her arm out or a wristband, and it's just those sort of things that were hospital protocol but weren't easy for her.
Yeah. What would bridge the gap between good care and harmful care? We know that there's a lot of misunderstanding, and as you pointed out before, doctors who maybe have knowledge but haven't actually been taught this at a university because it's not something you can study.
Yeah, when Beck went into hospital earlier this year, some of the doctors were prepared to look at the research, acknowledge what I had to say. Others didn't really want to know anything about the research. In that they were in the same room as the other doctors that were asking for links, or asking for the information, and then we had some that would just sit there completely ignore it. And one was a psychiatrist who thought that the condition needed psychiatrist help, and that it wouldn't acknowledge even documents that I had from psychiatrists about ME, still didn't want to acknowledge that, and were quite rude and disrespectful in the room when discussing things with Rebecca and I.
I know that this topic's kind of always sat in the background. We met first around 2019, and this was your request, help me find a doctor that will come to us at home. Tell me a little bit around what that journey has been like for you.
Well, most of the local GPs had little or no current understanding of MECFS, let alone severe ME. So we had to try and find a professional who would understand, had recent knowledge and expert advice. And at that stage, we actually had to look interstate for a specialist GP who was able to help with that. And of course, he has long wait lists because he's a specialist in that area. So you often have to wait quite a long time to get an appointment. And that's not always good if you're in a critical situation and need help straight away. But then he did provide good care and a sympathetic ear and expert opinion. So it was definitely worth waiting to see him. But to get a local GP, I had to approach many clinics. Usually, firstly, it's the receptionist or practice manager that you have to approach. So you have to hope and make them understand your situation, and that they will then pass that on, and the GP will agree to come and see you. But often that first hurdle is getting past that receptionist or practice manager. Hope that they have an understanding, and we'll pass that on to the GP. And then we did eventually get someone to come out to see Rebecca.
It's a big road, and I can't myself imagine what Beck's gone through, or you as her carer. But I really appreciate you taking the time to speak with us on severe ME, and we ask that people hear the voices of the carers. And for those patients and people with lived experience that are well enough to have their voice amplified, we thank you for taking the time to talk to us so that we can hear you. Is there anything else that you could think of that you wanted to add before I close up our little recording today, Sue?
I think just to be able to encourage the GPs to take those courses that you offer for them for their training, that even if it's just a short 15 minutes, that they are made aware of just the research, that there is research out there. I found some doctors, they were just like, oh, we haven't heard that there's any research being done. Whereas there's lots of research being done all around the world, but it's just not something that they're aware of.
And that's a really good, important part. Thank you for raising that. So Emerge Australia has a research digest. It's available on our website. So all healthcare professionals, people with lived experience, carers, government bodies can access that information. We have volunteers and we have some very clever scientists on staff who are scoping through these documents and doing a little summary to make it a little bit more accessible. And they're also in an audio format, so they can be stopped and paused rather than read, along with our education, which can be accessed as well. So if you would like any more information on those, please feel like you can reach out to us. Always happy to help close that gap with care. Thank you, Sue, and I wish Beck the best of luck with her next hospital trip and hope that this will be the last that she has to do for a while.
Yeah, thank you.
What a great interview that was. Thanks to Laura Allen, who did a great job there, and thanks very much to Sue McPhail. So, what we've heard today are some powerful stories of women who are either people with severe ME or are carers of a child with severe ME. And it's a pretty gut-wrenching listen, to be quite honest, because what you are all going through is something that no one wishes to go through. And the challenge that we face is that as of today, there is no treatment that helps everyone. There is no cure. And in Australia right now, we have no financial resources other than those that are already several years old that are being poured into MECFS. We do thank the Federal Health Minister for our clinical guidelines, and that work has begun. But we do now need to fund research into MECFS that is dedicated MECFS research. We do need to fund the education of clinicians and allied health professionals, and we need to extend patient services to multidisciplinary in-home care for those who can't access care any other way. Just to speak to both you and Lynn, Lily and Lynn, whether you've got any comments to make about, what services are going to be the most helpful for people with severe ME. Lily, perhaps to you, what would be helpful? What would have been helpful for your parents when you were so sick?
I think my parents were really tireless advocates for in-home care, and like Lynn spoke about, like Sue spoke about, it was an exhaustive search to find a GP who was willing to see me in my home. I think it's a terrible position we're currently in, where people with severe ME are faced with the choice of significantly and permanently worsening their health as a trade-off for receiving care. I think so much care requires in-person treatment, can't be done through a screen. Telehealth is a really wonderful option in so many situations, but it's not enough. And I think that for me to have consistent in-person care for my parents as well would have been enormously helpful. To have education for doctors. I can't begin to explain the kind of sort of trauma that I endured from many, many practitioners misunderstanding what I was going through, for people who sort of looked straight through me. Lynn, I thought what you said was extraordinary about trusting Dan to know what's best for him. I had the experience that was so demoralizing of so many people sort of looking through me and sort of treating me like, because I couldn't communicate, I wasn't there anymore, and I didn't understand my body, and I didn't understand what was best for me. And so to have education for doctors, for allied health professionals, I think would have made an enormous difference for me and so many other people.
Yeah.
It's fantastic. Lynn, did you?
Oh, absolutely. And the idea that if someone is coming into their home, into your home, to treat the person with very severe ME or just see them collect blood or whatever, that the person has to be very aware that they have to be fragrance free, they have to be quiet, they have to be prepared to work in a low light conditions, and no talking. There's no dialogue. Everything has to be, unless of course it's the doctor asking really succinct, pointed, useful questions. Dan's not going to answer them. It'll be me. So, and I'm assuming that that's the same with most very severe sufferers. They're unable to, and you have to really look to the carer, balancing as a parent, balancing my emotional self who just wants to scream and go, ah, help, help, to being really cool, calm, and collected and advocating in a strong and unemotional manner is really important, because I do not want to be written off as a helicopter parent. Or so it's a fine line that you walk, a very fine line, of getting past those practice managers or whatever and saying, no, this person cannot attend an in-person clinic because they are too unwell. But then again, there's the next leap you have to have is permission to access all the healthcare on behalf of your child. So with Dan, he was too sick to do the power of attorney, because that would have meant having a justice of the peace come to the house and ask him questions and blah, blah, blah. So we had to go through the public trustee. All very difficult, but without that permission, we didn't have a leg to stand on. So the legalities behind accessing healthcare, they must be looked into too. It's just another straw on that camel's back. And another, you're explaining yourself and advocating again and again and again.
And ultimately, whilst we don't necessarily have that service, we're able to, at Emerge Australia, support you in that. But that is a critical point, and you and I discussed that over the phone last week, that, having a power of attorney has been so important for you, something that most people don't think of.
No.
But if you have to make decisions on behalf of your child who is nonverbal as a result of severe ME, you have to have the permission to do that. And that's a whole area of work that I think we as an organisation need to take up and make available to members of the community. So believe it or not, we're right on 3 o'clock right now. It's 2 minutes past 3. There are comments that some people have made, and they're lovely comments. Thank you to everyone who was so kind in thanking us for putting this symposium on, and so grateful to you, Lynn, and to Lily, and to you, Sue McPhail, and Laura Allen, for the very, very personal, poignant, stories that you've told of your experience. I am reminded in the chat that if you wish to contribute to MECFS and long COVID research, you can go onto the Emerge Australia Biobank part of our website and log on to the registry. We always need more people living with MECFS and long COVID, as well as healthy controls. So that's one way you can help. The other thing that someone has just said, people unable to attend appointments and examinations required for salary compensation and TPD claims through their super as well. So that's another issue that we probably should develop some resources on. And of course, we have got resources for carers on our website, but you can always call Laura and the team on our telehealth service if you want to speak to any of them about any concerns you've got. We're there for you. I think what I'd like to do now is close out today's symposium and reassure you all that we not only see you and hear you, but we are determined to bring light to the darkness that people with severe ME face. We're determined to fight for you, for multidisciplinary in-home support, for greater support for the unsung heroes who are the carers whose lives are devoted to caring for their children and their loved ones, for greater investment into ME research, for a cure, for biomarkers, for enhanced patient services, for education of our clinicians so you can be diagnosed, and most importantly, for recognition. And today, on Severe ME Day, it's actually a day of hope because we now know that your DNA, for those who've got ME and severe ME, is different. We know that now, and that change needs to be evidenced in the additional research and work that needs to go into finding new treatments, biomarkers, and hopefully a cure. We'd love you to engage with us at Emerge Australia, so you can go to our website on www.emerge.org.au and link through to this symposium and all the information on our website. Both audio and video recordings of this event will be published in the coming days, and we do urge you to hop on board with our advocacy efforts and our other events that we hold on your behalf. Your voices must be heard, and together we can make change happen. I want to thank Lily. I want to thank Lynn. I want to thank Sue and Laura, Andrew in the background, Jane Fairley, Laura Cool, and all the team at Emerge Australia who make these events possible. Without you, it wouldn't happen. Thank you for joining us on Emerge Australia's 2025 Severe ME Day Symposium. And as we close out this event, we're once again playing Lily's dad's song, Fix You by Coldplay. Thank you everyone for joining us, and bye for now.